Next 25 minutes will be about how to manage thoracic kyphosis with growth-sparing instrumentation.
Okay, to my left are three esteemed colleagues, and I'm going to lead this off with a very quick discussion of what we're looking at. But remember that most of the devices that we're using are kyphogenic in nature. Any distraction-based device causes kyphosis, and creation of kyphosis when you bend your rod or whatnot furthers your kyphosis through distraction. And overcorrection of your kyphosis in an attempt to match kyphosis can often cause junctional kyphosis. And so the question here is what to do. And if you look at sort of all comers in the literature, where our rate of junctional kyphosis probably runs around 25%, but I would argue that for patients who are previously kyphotic, that number is going to be higher. And so sometimes we select sometimes we select poorly. And so this is a patient of one of my colleagues who had severe arthrogryposis as well as cerebral palsy, who was treated with the attempt of trying to bend out a little the kyphosis, and the rods became prominent, and one rod was removed, and you can imagine where this went. And we're still there. And so we have not fused up to the cervical spine yet. This is a patient of mine early on with a chromosomal abnormality that initially failed instrumentation of the spine, so we took it off to the pelvis with rib-based fixation. You can see that that didn't work particularly well and ended up at a relatively young age with a definitive fusion that looks not particularly well. But sometimes you do well, and so sometimes it can work. And this is a child with more proximal kyphosis, and we opted to treat her with halogravity traction and magic rods, and she has done well from that. And so the question is, how do we prevent it, and how do we know which one is going to come out? And so we're going to focus for this section on looking at three different devices and how, looking at those specifically, we can try to minimize the risk of PJK. So we're going to start off, I believe, with Laurel.